A new COVID-19 wave is making headlines across Asia, sparking concern among health officials and the public alike. The region, which has experienced several waves before, is now facing a fresh challenge that is rapidly evolving. This surge is being driven by the KP.2 variant, a fast-spreading descendant of Omicron that has quickly become the dominant strain in several countries. Its ability to move swiftly through communities has caught many by surprise. KP.2 is not only more contagious, but it can also bypass immunity from past infections or vaccines, putting even those who thought they were protected at risk. This means that people who have already had COVID-19 or received their vaccinations are still vulnerable to infection. In Japan, the impact has been especially severe. Case numbers have doubled in just a month, overwhelming healthcare systems and forcing hospitals to reopen special COVID units that had previously been closed. South Korea, China and India are also seeing rapid surges, particularly in densely populated urban areas where the virus spreads more easily. The rise in cases is putting pressure on local health authorities to respond quickly. What sets KP.2 apart from earlier variants? Many patients are reporting severe headaches and persistent insomnia, symptoms that are more intense and longer lasting than before. These symptoms are making recovery tougher and more exhausting, with some people taking weeks to feel better, compared to the shorter recovery times seen with previous strains. The emergence of KP.2 is a stark reminder that the pandemic isn't over. The virus continues to mutate, creating new challenges for scientists, doctors, and communities everywhere. The rapid spread in Asia serves as a warning for the rest of the world. What happens there can quickly become a global problem if not contained. Vigilance and preparedness are more important than ever. Staying vigilant, sharing accurate information, and taking steps to protect the most vulnerable in our communities is crucial as we face this new chapter in the ongoing fight against COVID-19. COVID-19 variants often follow a predictable path, a pattern that has become all too familiar over the past few years. Each time a new variant emerges, scientists and public health officials watch closely, knowing that what happens in one part of the world can quickly affect us all. What starts in Asia, where many variants are first detected, soon reaches the US, often within a matter of weeks. This rapid movement is driven by our interconnected world. The original outbreak, Delta and Omicron, all spread globally within weeks, thanks to international travel and the sheer volume of people moving between countries every day. Airports and flights become highways for the virus, making containment a challenge. Now, KP.2 is likely to follow suit, with experts expecting a US surge in the next 2 to 6 weeks. Early data and modeling suggest that this variant could spread even faster than some of its predecessors. Even before KP.2, US COVID-19 deaths are already over 300 per week, and could rise sharply if the new variant takes hold. Hospitals and healthcare workers are watching the numbers closely, bracing for a possible increase in cases. Ignoring early warning signs would leave communities and hospitals unprepared, risking preventable illness and strain on our healthcare system. Our experience with past variants shows the need for swift action. Delays in response have always led to higher case numbers and more severe outcomes. Now is the time to reinforce defenses, communicate risks clearly, and encourage everyone to take precautions, especially as we learn more about KP.2's characteristics. Proactive steps, like masking, vaccination, and protecting the most vulnerable, can help lessen the impact of the coming wave and keep our communities safer. Seniors, especially those 65 and older, face the highest risk from new COVID-19 waves. As new variants like KP.2 emerge, this age group remains particularly vulnerable, not just because of age, but due to a combination of health and immune factors. In the US, over 80% of COVID-19 deaths have been among this age group. This staggering statistic highlights just how much more dangerous the virus is for seniors compared to younger populations. Aging weakens the immune system, making it harder to fight off new variants like KP.2. Seniors' bodies respond less effectively to infections, and their immune defenses are slower and less robust. Chronic conditions, heart disease, diabetes, COPD, are common in seniors and worsen COVID-19 outcomes. These underlying health issues can make even mild infections much more serious, increasing the risk of hospitalization and long-term complications. The virus can trigger severe complications from heart failure to respiratory distress. Seniors are more likely to need intensive care, and recovery can be much slower and more difficult. Immunity from past infections or vaccines fades over time, and KP2 is better at evading old antibodies. This means seniors may not be as protected as they once were, even if they've had previous shots or infections. Staying up to date on boosters is critical for seniors' protection. Regular booster shots help strengthen their immune response and offer the best chance to avoid severe illness. Protecting this group must remain a top priority. By focusing on prevention, vaccination, and early treatment, we can help ensure seniors stay safe and healthy as the pandemic evolves. For seniors, the threat isn't just severe infection. Long COVID is a major concern. About 1 in 4 people over 65 who get COVID-19 develop symptoms lasting months. Persistent fatigue, shortness of breath, and brain fog can rob seniors of independence. Mental health suffers too, with depression, anxiety, and insomnia becoming common. Many never fully recover, needing ongoing care and support. Long COVID impacts families and strains healthcare systems. Preventing infection is the best way to avoid these long-term effects. Protecting seniors from KP2 is about preserving both lives and quality of life. With KP2 on the rise, seniors and families must act now to stay safe. Wear high-quality masks in crowded indoor spaces and wash hands frequently. Get the latest COVID-19 booster. New vaccines target recent variants and boost protection. Keep a supply of essential medications to avoid unnecessary outings if sick. Improve home ventilation, eat a balanced diet, and consider supplements if recommended by a doctor. Prioritize sleep and light daily exercise to strengthen immunity. If symptoms develop, self-isolate, get tested, and contact your doctor about antiviral treatments. Staying alert and prepared can help seniors navigate this new wave safely.